and welcome to Leaders of Tomorrow, the series that celebrates the spirit of entrepreneurship among small and medium enterprises. Bangalore contributes to almost 40% of India's total revenue from the biotechnology sector. Today it houses 182 out of 350 biotech firms in the country. Closely related to the scope of biotech are also pharma and biopharma companies. One such company is Kemwell. Formed in 1980 by Anurag Bagaria, Kemwell provides manufacturing and development services for pharmaceutical products. Today, led by his son Anurag Bagaria, Kemwell has had a steady growth rate of 35% over the last 5 years, making it one of India's leading formulations contract manufacturers.
Our first customer was Glaxo, and since then we now have built 5 facilities in India and 2 facilities in Sweden. The services we offer include everything from formulation development, analytical development, clinical trial manufacturing, and then commercial manufacturing. So if a customer comes to us with an API, we can hold his hand and take him all the way to make a product and then finally do commercial supplies and commercial packaging for global markets.
Despite its experience in manufacturing analgesics, antacids, cough and cold liquids and infant care products, Kemwell has stayed away from developing its own products and chosen to remain in the B2B space to avoid conflict of interest with its partners. This strategy has resulted in them manufacturing 5 of the top 10 brands in the world and supplying to over 80 countries worldwide.
Our customers include some of the top Indian multinationals and global multinationals. So from large global multinationals like Pfizer, GSK, Novartis, Johnson & Johnson to more niche players like Allergan. And in India, large companies like Cipla and smaller regional players like Microlabs are all our customers.
The volume of business what we are doing right now in India, if you say our liquid plant, which is exclusively catering liquid for the market, it's an output of semi-solid units. And as far as the tableting is concerned, we can make 2 billion tablets and capsules right now. And we have expandable capacity for another 3 billion pieces, which will be expanded as we get new business.
In response to the unique demands of its clients, Kemwell has developed world-class infrastructure in manufacturing, quality control and quality assurance systems. In 2008, they set up a new R&D facility here in partnership with one of the world's leading pharmaceutical companies, GlaxoSmithKline. This R&D center has been set up to cater to clients' global oral healthcare development projects.
So every consignment of raw material what we receive, we do the sampling activity from our quality control. Every consignment is tested as per the specification for all the various tests which are approved. Then once after the approval of the quality control, the materials get used in production.
1 year we have almost added 30 scientists to our firm, and out of that about 7 or 8 of them are PhDs. And we feel there's significant growth in pharmaceutical development and in oral solids export business.
For 21 years, Kemwell has provided the highest standard of services to its clients. Whether it's modifying an existing product, developing a new product, or increasing current manufacturing capacity, Kemwell is the one-stop shop prepared with people, facilities and equipment. Generating a turnover of 310 crore rupees per annum, the company is looking to expand both nationally as well as globally. With 3 more facilities coming up in India and 1 acquisition in Sweden on the cards, Kemwell is now gearing up to enter the biologics space as well.
We are setting up facilities to manufacture highly complex products like monoclonal antibodies, and also over there we will be doing both the drug substance manufacturing and the drug product manufacturing.
Kemwell has been able to forge strong associations with companies like Matrix and Hemogenomics, and that has helped the company develop inroads into critical areas like blood screening and testing.
So right now we're building a larger liquids plant. Today we do about 100 million bottles of liquid orals every year. The new plant that we're constructing can do over 300 million bottles, so we're tripling our capacity in a new state-of-the-art, very highly automated plant. We're building the biologics facility in a collaboration with Boehringer Ingelheim from Germany. And so apart from all these activities, we're looking at acquisitions, and we're in discussions with a couple of customers to build dedicated plants for them for some of their niche products.
A complete family venture, Kemwell contributes 10% of its total pre-tax earnings annually to support the community. In an attempt to reduce its carbon footprint, Kemwell has planted 4,500 trees across Bangalore city. A green initiative that is bound to go a long way in saving the environment from pollution.
What we have actually done now is that, we have used certain well accepted methods of identifying the carbon generation out of our manufacturing units. We also found out what is the equivalent number of trees that we have to plant to offset the carbon that we are generating.
In return, Kemwell hopes for greater support from the government in bringing the Indian biotech industry at par with its Southeast Asian competition.
The price is fixed 10 years ago. Considering the cost of electricity, labor and other infrastructure, the same thing is continuing. So margins are squeezing. The requirements are increasing, regulatory requirements are increasing. So it is tough time.
A lot of different countries, if you map out, countries like Singapore, Malaysia, South Korea, Taiwan, all of these, emerging countries into the biotech industry are providing a lot of incentives for the industry. Not only tax incentives, but a lot on training, on R&D, on collaboration between academia and the industry. And I don't see that much happening in India, leave alone Bangalore.
Whether or not the government answers Kemwell's plea is something that we all will just have to wait and watch out for.